In this lesson, you will, after you complete this lesson, you'll be able to describe three characteristics of normal newborn feeding patterns in the first 100 hours. Let's begin with thinking about how babies feed in utero 24 hours a day. They're being fed through the umbilical cord 24 hours a day. This means they're not hungry when they're born. They're not waiting for food. They aren't an empty vessel just waiting for food to be delivered to them immediately. They've already been fed up to the moment that the umbilical cord was cut. After they're born, then their post-birth feeding routine becomes at intervals. Now, the reason we talk to parents about feeding the baby frequently, in addition to what we know about that supporting optimal milk production, is that this is the time when they're adapting and learning how to feed themselves. They're no longer being fed automatically through the umbilical cord. They need to practice all the skills it takes to feed themselves. Also provides that critical feedback to their mother's body to signal for milk production and to signal for the volume of milk that they're going to need. When we interfere with that pattern, that is when, as we've discussed already, milk production becomes not unsynchronized with what the baby needs. So when we think about why babies are feeding frequently, these are the reasons why. They need a lot of practice. They need to signal the body frequently so that the body can make all the milk that this baby is going to need. Understanding how much babies need to eat is another critical part of what new parents actually need to know about newborn feeding. So Western society tends to teach that it's normal, common, and correct to feed babies with bottles because then you know how much the baby is getting. Rather than teaching culturally that there are ways to tell if a breastfed baby is getting enough milk, we simply teach that if you use a bottle, you know exactly how much milk is going into the baby. Now, set aside for just a moment the fact that we know from research that commercially produced infant feeding bottles produce inconsistent results. If you measure the amount that is put into bottles, it often does not match up with the markings on the bottle. It is very common to find that. So in addition to not actually knowing how much milk is going into the baby, what is truly more important to know when we're trying to assess how a baby is feeding is all of the other things that you can only see during breastfeeding. So we want to make sure that we are setting up expectations for parents with what is normal about breastfeeding and how breastfeeding can actually tell us what is going on with the baby. Because breastfeeding is instinctive for babies. If they can't do it, if something is interfering, there is a reason. And that reason needs to be investigated. That reason could be they're having difficulty breathing that's not obvious on the outside. They have an infection. They have an anatomical issue that's interfering with their ability to feed effectively. They are actually less mature than we thought that they were. There are many things that a lack of breastfeeding can tell us. We need to give babies the opportunity to breastfeed in order to communicate those things with us because they don't have any other way. When we override all those things by bottle feeding, it becomes difficult for babies to be able to show us those things. So these common beliefs that parents come to us with that infants are supposed to be fed every 3 or 4 hours, they come from just our cultural understanding of what babies do and a lack of people having seen breastfeeding actually happening. It's a really important part of the feeding lessons that we give prenatally. We really need to explore what parents already believe about feeding, what they've heard, what they've seen in their life. You know, if the father in the couple has experienced watching their own mother breastfeed their 5 siblings, they're going to have a really different sense of what feeding looks like than if they saw bottle feeding in everyone that they've ever grown up with. We have to think about what people have seen, explain to them what is real, and then help them put that information together. If we simply tell them something different than what they already knew, it's not always easy or simple for them to integrate that knowledge. It's not always that easy for them to believe us. Why would they believe us if we're the only person telling them something that's really different from what everyone else says? They have to know that they can trust our information. When we explain why it is the correct information, it's easier for them to start assimilating that, integrating it, and envisioning what it will be like to feed their baby. We want them to know that newborns have extremely small stomachs with limited capacity. It's possible to overfeed a newborn. Later on, their stomachs begin to be able to stretch, but when they're very small, it is possible to overfeed them. And what happens is that because their stomachs do not stretch very much, it becomes really uncomfortable for the baby. They tend to spit up a lot, and it's difficult for them. So it puts them in a slightly distressing situation. Now, we want to make sure that they understand that they're probably going to see visually things that make them think their baby needs a lot, like a high volume. For instance, if during pregnancy they receive a breast pump that comes with its own bottles, those bottles are probably big because for most of the time that people are using a breast pump, they need larger bottles. They're going to get an ounce, 2 ounces, 3 ounces, 4 ounces at a time. But that's not what they're expecting to see in the beginning. So it is really important that we think of all these ways that people are exposed to information, both words, verbally, and visually, that give them these perceptions of what is supposed to be happening. We also know that by 96 hours postpartum, what we're studying here, what we're focusing on here, it's very reasonable to expect that the baby will be feeding well and feeding regularly, that they will have robust milk production, and that it's continuing to increase, and that any potential challenges in breastfeeding have been identified. If not already addressed, they've at least been identified. But before that happens, it's very, very normal for doubts to arise, for concerns to come up. The key to helping people to meet their breastfeeding goals and to keep both of them safe is making proper referrals and providing intervention at the right time. So we want to be sure that we're always intervening at the correct time to solve the problems that we see in front of us at that time. This means that if the first thing that we're seeing is that parents are not aware of the fact that babies are supposed to feed frequently, they're going to believe that something is wrong with their baby, and they're going to feel a need to intervene by perhaps feeding their baby some formula, feeding their baby from a bottle, trying to use a breast pump. All of those things we know can be complicating to the first 100 hours experience. So we have to look at what we expect to be happening by that time of 96 hours postpartum. What are all the things that happen in the interim there? And how can those things go off track based on the information that people have, what they're expecting, what they believe, what they think is going to happen, what they envisioned, and even thinking about what's already happened. For somebody whose birth went very differently than what they anticipated, sometimes they already have a sense that they're not good at this, right? They think they already failed somehow or made mistakes. And so they start to have this downward spiral of, I can't do anything right, so why would I be breastfeeding right? So you have to really think about all these places where things can get sort of complicated and overwhelming for new parents. We want them to think about the first 100 hours as being a time where they can accomplish a significant amount of breastfeeding. 4 whole days of breastfeeding, that's 96 hours, roughly 100, right? It's a significant amount of actual practice feeding their baby. So that's many times they've brought the baby to the breast, they've adjusted things, they've gotten the baby positioned better, they've achieved a better latch, they have felt what it feels like to breastfeed, to have their baby latched, to have their baby sucking, to hear and see their baby swallowing, to see what it looks like when their baby is very hungry at the beginning and what it looks like at the end when they get relaxed and stop sucking very actively. We also expect and want them to anticipate they're going to receive a significant amount of education. If they didn't receive a lot of education prenatally, they may need to get a lot of information in this time frame. And when that happens, we need to make sure that that information they get is tailored to what's going on and it's tailored to this time frame. What do they need to know right now about the first 100 hours and the next little pieces of it? What to expect next? If they haven't yet experienced a feeling of fullness in their breast, more milk there, more milk coming out, what should they expect to feel? What should they expect to experience? This way, they're not running down the road with what do I need to do when my baby's 10 weeks old or when my baby's 4 months old, but they're focusing on the here and now, getting the experience they need, building the confidence that they need to breastfeed today and tomorrow. Next week is next week, but today is important so that they can continue to rely on the breastfeeding that they are already doing. We want to continue to expose them to these best practices because we know that these best practices for optimizing, establishing breastfeeding in the beginning, this is what leads to the best outcomes, health-wise and breastfeeding-wise. We want to be sure they're exposed to these best practices every time. When a challenge comes up, the response is always going to be exploring what's happening, finding out what they need to know, bringing the baby back into skin to skin, responding to the baby's cues to latch, breastfeeding, hand expressing and spoon feeding if necessary, resuming skin to skin. These are the steps. This is the cycle. This is what we do every single time there's a problem. We don't leave any steps out and we don't skip anything. If we skip, they're going to skip it later. So when we have these contacts with people, we want to constantly model, this is the cycle we resume. One of the things to remember with this is that as we begin to explore what's going on and what they know and what they're going to need, the place their baby should be while we have that conversation is skin to skin. Modeling that every single time is really important. It's important for them to feel that physically and to experience that and to associate that in their mind with this is what I do when there's a problem. I could talk about the problem. I can ask questions about the problem. I can think about what's going on. But the way I do that is I put my baby skin to skin and I really think about what is happening and what I need next. And during that time, what we expect, especially with the baby who's within the first 100 hours, is that that baby is still acting completely on instinct and is going to do the things they need to do to prepare for feeding, going through all of the movements and steps that they need to go through to get ready to latch and to signal that they're ready and need to get to the breast so that they can start moving there. When we make sure that this is happening, even during that conversation about whatever concerns or doubts or issues are coming up, this is how we show people that breastfeeding is the answer to the challenges. It's going to help them have the right mindset about how to approach problems with breastfeeding. And it's going to help avoid interventions that aren't necessary. It's going to support easier, simpler processes for responding to breastfeeding challenges and prevent early complications and creating a lactation journey that becomes very complex very early on. And it's going to prevent problems and compromise of milk production because we know that skin to skin is one of those best practices.